everyone. I'm Dr. Renee Mehrra, and today I'm talking to Dr. Thomas Chandy, who is in Bangalore, India, and is the chairman of the Hosmat Hospital in Bangalore. He's a US board certified orthopedic surgeon and did his residency at the Brooklyn Jewish Hospital and Medical Center. This was in the 70s. And then he became the chief of orthopedics at the Claremore Regional Medical Center in Oklahoma, and where he was till 1993. And after that, he went back to India and started this Hosmat Hospital. That's a neuro accident hospital. Thank you very much, Dr. Chandy, for joining us all the way from Bangalore, India.
Thank you. Glad to be here.
You are a doctor by day and a musician by night.
Maybe, yeah.
I'm gonna try and please you in every way I can. Since I met you, baby, my whole life has changed. Since I met you, baby, my whole life has changed.
Great. I mean, I think that's very therapeutic at the same time. Very checkered career, you know, and you did the first joint replacement surgery in the 70s, and you did 2,000 joint replacement surgeries in the United States. That's a big achievement. So tell us about your stay in the United States.
I was in the US for 16 years, out of which 6 years was in New York, 1 year in the Bronx, Lebanon, Albert Einstein, and 5 years at the Brooklyn Jewish Hospital Medical Center. And then another 10 years in Claremore Regional Hospital, which is a suburb of Tulsa, Oklahoma, in private practice. Before that, 1 year of fellowship at University of Oklahoma, Oklahoma City, in joint replacement and arthroscopy and sports medicine.
And how was it in Oklahoma, you know, doing the first joint replacement surgery?
Because joint replacement in the 80s was quite new over there.
Yes.
And after my fellowship, I was one of the first to do it in that area. So it became, I mean, fairly busy, and I did a lot of joint replacements and arthroscopic surgeries, and I was happy about that.
Mm-hmm. And then you decided to move to India. What prompted you to do that?
I decided to move to India, not in the first 2 years, maybe after 10 years of being in the US, because I was so busy training and, you know, looking to develop my skills and fellowship, and before that residency. It was only after I started my private practice in Oklahoma, I decided, I thought about the idea of moving back to India.
Mm-hmm.
And my wife supported me very well. And after I started my practice in Oklahoma, it was a very busy practice.
Mm-hmm.
And I'm about 31, 32 years of age. And it was successful. So in a very short time, I was able to earn a good amount to even think about to start a hospital in India. And decided to go ahead and start an orthopedic and a sports medicine and joint replacement and trauma hospital in Bangalore, which was my hometown. And another major factor, I think, was my wife and I got a little homesick. When I was in New York, I guess you don't feel it because New York is such a cauldron of all cultures. But when you move to the Midwest and you are a very small minority, and I think you do feel it a little more. Of course, I could have gone back to New York, but New York is a very competitive place. So we decided to move, partly because we were homesick and wanted to get back to to our roots. Yeah, can say it like that way.
Right, and you've done phenomenally well in Bangalore with this hospital, and you've got a second hospital also.
A second hospital, and just starting a third hospital.
Wow, congratulations! And they're all for orthopedic surgery?
They're all for
Trauma?
the name of the hospital, Hosmat, which is an abbreviation, Hospital for Orthopedic, Sports Medicine, Arthritis, and Trauma.
Wow.
So that's what we deal with.
Right. And you see a lot of patients with trauma injuries?
Yeah, see, Bangalore is a population of 12.5 million. It has grown so much since I came in the, in the 90s, and the traffic, is so big, and the number of vehicles is like 6 million vehicles in Bangalore. So the number of injuries and accidents is very high.
And you've been there since 1993 now. And you're also one of the orthopedic doctors for the Cricket Board of India.
Well, I see several of the cricketers who come for consultations for injuries, and the board has approved the hospital for evaluations in the DEXA scan, which is which gives the bone density and the fat analysis and evaluation. And I see consultations, and when anybody needs treatment, I take care of them. I'm not an official only orthopedic surgeon. There are quite a few number of orthopedic surgeons who are associated with the board.
Right. And talking about DEXA scan and bone density, it is important for people, I think, for women especially, after their menopause, to get bone density test done.
Yes, I think so, because bone density is a sort of a baseline. It gives you an idea of what your bone density status is, and it's recommended more in women from the mid-40s onwards. Men, little later, maybe from mid-50s onwards, you see. And because in women, it's known that the estrogen level after the mid-40s gradually decreases, and estrogen protects the bones and gives the bone its normal strength. So how does one compensate for that? The two things are to be physically active,
right,
walking, whatever other physical activities, and making sure that you have adequate vitamin D. And when the bone density is done as a baseline, it's also good to have the vitamin D level also. And if it's low, then take vitamin D as a supplement, and calcium also. So I think these are important, but the more important part is to be physically active. If you're sedentary and you're sitting down at the computer, or if you're watching TV the whole day, if you're retired and not doing any physical activity, that is the danger. Whether you're a woman or a man, that is a danger. Bone only understands one thing, the loading. Loading is the walking. And the loading improves strength, bone strength.
Mm-hmm.
That's why somebody who happens to be in a cast, for example, even in 2 months' time, even if you get even a 25-year-old male, osteoporosis develops because of the inactivity so fast. So activity is extremely important, plus the vitamin D and calcium.
What about weight bearing and the exercises for strengthening the bones?
Exercises is important. It depends on the type of exercises. The exercises, good stretching, yoga, helps the flexibility, and the loading exercises are important, which is putting the load on the leg. Whatever exercise that involves putting load on the leg, like walking, dancing, aerobics that involves putting load, is going to benefit you. some amount of, little bit of, I wouldn't say a full push-up, but even against the wall, doing pushing against the wall helps to strengthen the arm bones. So loading is very important.
And weights?
Yes, it's well known that those who are obese, the osteoporosis progress is much more rapid. So if one is slim and active, the chances of osteoporosis is much less. Your bones are quite strong. Lifting weights is good because it loads your joints and bones. And one has to be cautious in knowing how much of weight you lift. Don't go overboard in lifting, lift a very, very heavy weight overhead and squats, etc. But light weights to medium weights is very, very good for general health and to prevent osteoporosis. And get a trainer and follow the exercises based on your age.
Okay.
That'll be good.
Right. Now, let's talk a little bit about your music and your jazz style of singing.
Yes, I have a eight-member jazz band for the last 22 years, and I enjoy music. From the time I was in school, I had a band in school called the Spartans, and I had a band in college in Bangalore called the Missing Links. It was a rock band. And ever since then, I've always enjoyed music and to perform, sing on stage. So it's an enjoyable thing. And, as a student, music was all by listening, by ear. But in Brooklyn, during my years at the Jewish hospital, I studied music and I went to Park Slope. There's a school called the Brooklyn Conservatory of Music.
Right.
And in the evenings, once a week only, so it was easy, and I learned to read music. And I got myself a keyboard, and then got interested in jazz after that. And ever since then, I've been very keen on jazz and blues. And my band is called the Jazz Revival. We are a jazz band and a blues band. And I'm the vocalist, and I enjoy it.
And you recently performed at a orthopaedic conference in Bangalore.
Yes, just last week we performed at, it's a Karnataka doctors. Once in 4 years, Bangalore hosts it, and about 500 orthopedic surgeons. They asked us to perform at their inauguration, so it was like a concert. So we enjoyed it. It was good.
Our next song is a Duke Ellington jazz song. I hope you like it. Missed the Saturday dance, heard the crowd at the floor. Couldn't bear it without you. Don't get around much anymore. Thought I'll visit the club, got as far as the door. Memory being waited on dates might have gone, but what for? Awfully different without you. Don't get around much anymore.
Get the time for all this, you're the chairman of the hospital, you do joint replacement surgery, then you have your music band. And you also have a museum of 275 musical instruments.
Yeah, from my New York days, I got interested in collecting musical instruments. And, excuse me, in those 16 years in the US, I had the opportunity of collecting a lot of instruments because, one could afford to do it financially. And I traveled in the US to various shows, music instrument shows, and I became a member of the Musical Instrument Society of North America. And I did collect most of my musical instruments while I was in the US. And I brought the whole thing down to Bangalore in 2 containers. Yeah.
Wow, that's great. Lastly, what advice would you give to your patients and to everybody out here who's watching our conversation? What advice would you give for people to stay healthy?
To stay healthy, one has to be active. One has to be reasonably slim. Diet is very important. Avoid excessive carbs, and keep the weight down. Do not get into an obese range. So your BMI has to be checked. BMI should be below 24.9. And it's easy to calculate. One goes to internet and see how to calculate the BMI. And that's important. And the other way to stay healthy is, whatever medications you've been advised, please take it regularly and have checkups. Have checkups with your doctor, because, high blood pressure called hypertension, people think that you have to be tense to get hypertension. No, it's just the arteries, and it's very, very common, and it's dangerous to have a high blood pressure without treatment. So have regular checkups and follow any medications that have been advised. Just follow that, and keep yourself occupied. Keep your mind occupied, especially in older people, to prevent dementia, etc. Keep your mind very active, whatever it is. Your crossword puzzle, or getting into playing some instrument, or bridge, whatever. You may use your mind. Keep your mind active, and these are the ways to keep healthy.
And when you say walking, nowadays most of our cell phones have those walking steps app. So how much should one walk for? Like minimum 2 miles, 3 miles a day?
It's recommended that one needs 150 minutes per week. In sports medicine also we recommended, and for cardiac problems prevention, 150 minutes per week. So that translates to about 25 minutes a day.
Mm-hmm.
And that is a medium level exercise that brings up your heart rate to a certain extent, not an evening walk. Either walk briskly, or use an exercise stationary bike, or a treadmill, or basically a fast walk in a park for 30 minutes. And say, to get that aerobic fitness and cardiac prevention, you need to walk at least 2 miles a day.
And then we're talking about brisk walking here.
A brisk walk, not a leisure walk, chatting and going. It's a brisk walk, a real exercise walk. Yeah.
Well, are you planning to make a trip to the United States very soon? I know your daughter lives here in the
Daughter
US.
lives there, and I have a baby grandson. I come regularly. I come every year. I've been coming every year to attend conferences and keep up with all the new things. And my daughter, who was born in the US and moved back with me when she was 8 years old, moved back to the US about 6 years ago, and she lives there in Philadelphia. And I go, every 6 months or so and visit her, and I enjoy it. I have a lot of friends in the US, and I keep in touch with them. I'm also was the founder president of the St. John's Medical College, the alumni, and there are several hundred of St. John's Medical College in Bangalore, the alumni in New York and the Northeast and all over the US, and I keep in touch with them, so I enjoy my visits to the US.
Oh, Thank you very much, Dr. Chandy, Chairman of the Hosmat Hospital, U.S. Board Certified Orthopedic Surgeon, and a jazz musician. Thank you very much. And I'm Dr. Renee Mehrra. Stay healthy, stay positive.
Thank you so much. Happy to be part of your program. Thank you.
Thank you.